Most of you will already know that come November time, it will be a requirement for care home staff and associated contractors, for example, hairdressers, to be double jabbed in order to come into a home and to work. As such, what we're trying to do across Cornwall and the Isles of Scilly is to make sure that any care home staff and contractors who haven't been jabbed yet have the opportunity to get jabbed, that it's available to you, but also that you get your questions answered and you make sure that this is the choice that you've decided to make, that you feel comfortable and confident in. One of the main questions that I get is, why are care home staff being targeted with this mandated double vaccine requirement? There's no easy answer to that one, if I'm really honest, but one of the main issues that we've seen with this pandemic is actually the care sector were hit the hardest in terms of severe illness and mortality from COVID-19. So that's care home residents especially, who are older but also have many other health issues that make them more at risk for those severe outcomes from COVID-19. So this requirement to have care home staff and associated contractors double jabbed is really meant to help support you as staff from preventing severe illness and mortality and death, but also in an attempt to help support those residents in those settings to ensure that they aren't as at higher risk of those severe complications. We know that no vaccine is 100%, so the more people that get that vaccine who work with or for vulnerable people, such as those living in care homes, the better chance we have to make sure that those severe outcomes don't happen. Another question that I get asked is that some staff are looking for exemptions on ethical grounds. And at the moment, there's no specific detail about exemptions, other than to say it will likely be aligned with the likes of the COVID vaccination pass and those people traveling internationally. So you'd be able to show your status. Exemptions are self-declared in that at the moment, and there's more information that's likely forthcoming in the next few weeks, but it is likely that you would self-declare any exemption that you might have. We're still waiting for clarifications around whether ethical grounds are going to be taken as exceptions to the mandatory requirement for being double jabbed in care homes. I've had some care staff come to me and say they've had the first dose of AstraZeneca, as care staff were eligible really early on when vaccines were made available. Subsequently, we had the issues around blood clots as a side effect. And so many care home staff who had the AZs were really concerned about going back to get the second one and have not done it yet. So effectively, what the advice is that unless you've had any serious complications with the AZ, you should continue on to get the second one. The risk of anything like those blood clots, for example, substantially reduces for that second one, though to be incredibly straightforward, there's always some risk. But the risk of a blood clot from getting COVID-19 is actually much higher. For those of you who've not had any of the jabs yet, Pfizer is available at our walk-ins, drop-ins, mass vaccination centres. If that is something that you had been concerned about before, that you might have to have the AZ, you can have the Pfizer. But for those of us, like myself, I had both doses of the AZ, and anyone who's only had one, it is much safer to get that second one after you've had the first one, and it's much safer to have both compared to the risk that COVID-19 presents. Fertility is certainly an important topic that's come up in regards to the COVID vaccination. The science behind the vaccines is really important to understand before we talk about fertility. So what happens when you get any vaccine is that it causes an immune response. Now that immune response makes your body ready to recognize when or if you get infected with something like COVID-19, and it can ramp up a response really quickly and effectively. That vaccine itself that's injected into your body goes through your lymph nodes and then is flushed right out. So the chemicals of the vaccine itself doesn't stay in your body, it doesn't rewrite any sort of DNA, and it doesn't go to any of your parts of your body effectively that would cause any sort of fertility issues. It gets flushed right out. So in terms of fertility, it's not something that is a risk in terms of fertility. And the decision to get the vaccine is really, really important. If you want to become pregnant in the near future, and we've still got a pandemic going on, actually the risks to baby and mum are much higher if they contract COVID, where it's really important that, if you do get the vaccine, you're much more protected. Risks to baby are much, much lower in terms of any sort of preterm birth or complications, which we have seen in the past year and a half in terms of pregnant women and their babies. What about long-term effects from the COVID vaccine? There's a lot of concern out there that it's been developed very quickly, it's not been tested for long enough, and what should we be worried about in terms of side effects for long-term health problems? Effectively, long-term side effects from any vaccine are incredibly unlikely, extremely unlikely. Vaccine monitoring for many, many years, decades and decades, has shown that side effects generally happen within 6 weeks, if they're going to happen at all, and from receiving your dose. And that's why the majority of the studies around the vaccine have actually required follow-up and looking for long-term side effects for at least 8 weeks, but many have moved beyond that. We monitor for side effects, your clinicians monitor for side effects, and we ask that anyone who experiences side effects from the vaccine report it to their clinician so that they can report it to the vaccination program, so we can continue to monitor the side effects. But the risk for COVID at the moment, and has been for over a year and a half now, is extremely high, and the vaccines are extremely effective in terms of our NHS colleagues, hospital admissions, and fatalities from COVID-19 have significantly dropped, especially in those most vulnerable groups, such as myself. I'm clinically extremely vulnerable, and the risk and serious illness has dropped substantially to what we saw in previous waves of the pandemic. So the benefits to getting the vaccine far outweigh those possibilities of long-term effects. Short-term side effects, yes, you might feel a bit fluey, you might not feel very good, headache, some people report a bit of nausea, fatigue. All of those side effects are on the NHS website, or you can look at the World Health Organization if you're looking for a more independent view on the side effects of COVID-19 vaccination. In terms of other ethical issues around the vaccines, one that has come to me several times is around the thinking that aborted fetuses have been used in the development and manufacture of the vaccines. It isn't right that. So what happens in terms of what's very common practice in terms of development of vaccines is using what's called fetal cell lines. So specifically, what's been done for example, in Pfizer and Moderna, is there's one fetal cell line that came from an abortion that took place in the Netherlands in 1973. And so the cells that they used, they grew and grew and grew over time. And this is really common practice in other research areas. So for instance, in cancer and other areas where medical research goes on, not just with aborted fetuses, but with other cells taken from the human body, has happened previously. So the cells that were used in the production of Moderna and Pfizer were from that line. They're not from that specific fetus, but they have been grown in laboratories for a really, really long time, and is commonplace across the medical profession and research and development for vaccines. What has happened since the COVID vaccine has been developed is, for example, the Vatican have released a statement supporting Roman Catholics to take up the offer of the vaccine, saying this is something that is really important and those of the Roman Catholic faith should be doing to help make sure that we can exit this pandemic as safely as possible and protect human life. Others have done the same, other religions and other groups and other faiths. So it really is an ethical issue for each of us to decide, but those are the facts around aborted fetuses or not in those vaccines, and certainly everyone will need to make that decision for themselves. Do COVID vaccines alter our DNA? I think there's a lot of information out about there that's really, really confusing. And it probably is helpful to take it back to basics about what these vaccines are actually doing and how they were made to actually work with our bodies. So there are lots of other vaccines that used to use, or that do still use live or weakened parts of a virus. They inject it, your body recognizes it, start producing a response so they can fight off if they happen to contract that specific virus. So in terms of the mRNA vaccines, which you've probably heard about for COVID, it's a slightly different situation. We're not using any of the virus. We're using basically a blueprint of what a piece of that virus might be. So it's called the spike protein. So use a blueprint of this spike protein. They're injecting that blueprint in there so your body can understand it and produce it, and then realize that that is something foreign to your body. That's the thing we need to attack. And because it's unique to COVID-19, if you come into contact with the virus and you happen to get it, your body already recognizes it as something that it needs to fight off and starts to mount that immune response. So it's not that it's altering our DNA, it's that the scientists who have developed this vaccine have mapped the COVID DNA and understood bits that your body would be able to read really, really easily so that in the future you can mount a response. So none of this, I've heard bits and bobs around pieces of lizards or going to change my body into, mouse or change my DNA and I won't be me anymore. So there's actually no possible way that can happen because it's not what is in the vaccine that's being injected isn't able to do that in the first place. And also, once that actual vaccine itself goes into your body, it goes through the lymph nodes, gets flushed out, and within a couple of days is flushed out of your system anyway. And your body is left to understand what it needs to do to mount a response if it comes into contact with the actual COVID-19 virus.